The historic Calvary Hospital in the Bronx is celebrating 125 years of care this year, and during this landmark anniversary, they have welcomed a new leader into the fold. Michael J. Fosina has recently been appointed as the hospital's president after having worked as chief operating officer at Calvary since March of last year. The Good Newsroom had the opportunity to speak with the new president about his plans for the future at Calvary and how the connection between Calvary and ArchCare strengthens their ability to provide care for patients.
Yeah, the future at Calvary is bright. Healthcare landscape has been changing all across the country, and it's certainly changing in New York. You now have independent hospitals that are all part of these big, large healthcare systems, these academic medical centers that do a tremendous amount for the healthcare of New York. Everybody around the New York metropolitan area knows how special the place is, but you don't realize how special it is until you actually get here. And I've always heard about Calvary, and we've heard about the tremendous work they've done. But the extent of the work that they do, the extent that the sympathy and empathy that the staff give the patients and families is nothing short of remarkable. Yeah, we're lucky to be a part of ArchCare, right? ArchCare is, I think, the largest not-for-profit post-acute provider in the state of New York. Patients need to be close to their family at end of life. And so the family wants us to move them to a location to where they're near. And the only way to do that is to expand our services. And we're in discussions about doing that. Patients only don't die of one diagnosis. They die of multiple diagnoses. And part of what we're going to do is we're going to expand and educate our staff on how to take care of those type of patients. So my job is to bring in the right leaders and the right clinical staff and let them do their job. I look at leadership pretty simply. The leaders in our institution, we're support. We're support for the clinical staff taking care of the patients on the floor, because that's the most important work that needs to be done. I walk the floors a lot. I walk in, I talk to patients, I walk down the hallway, I talk to family members. I ask them how things are going, what we can do better, learn about the patients who are here. And that's a really enjoyable part of my job, is to go talk to staff and hear them light up when they tell you stories about their life. You let them lead the conversation and they tell you what's special to them. And that gives them some joy at a very tough emotional time. And it's real special, and I so much enjoy doing that. The Cardinal has come up here. He's a tremendous supporter of Calvary and the mission we have and the work that we do. He walks around, he visits patients, he talks to family members. And he's a pretty special guy, and people connect with him very quickly. And we're lucky that he'll take the time to come up here and talk to our patients, talk to our family, talk to our staff about how special they are and the work that they do and the importance of Calvary in the Archdiocese and how it connects to all the parishes around the Archdiocese. So we're lucky that he's a supporter and that he does make time and effort to come up here. And I always thank him for that. The day I started here, I had a relative be admitted to the hospital here. And she spent 6 weeks here. And so I had the opportunity to see firsthand very early on from family members how Calvary responds and the care that they provide the family members. There was a daughter whose father is here, and he was here for quite some time, and he passed away. And she called, she was disappointed. She called the funeral director the next day, and she said, in my father's room were his rosary beads, which are very special to him. They had been blessed by the Monsignor of his church. He always had them with him. Yesterday, we took the rosary beads out of his hands and we hung it in the back of the room. And I want to make sure that he has those rosary beads. Do you know if they're still in the hospital room? Do you know if they are with them? And the funeral director said, let me check and I'll get back to you. And he called her back and he said, we went and checked your dad. The rosary beads were wrapped around his wrist with the cross in the palm of his hand and his palm closed. So the staff took it upon themselves to make sure that they went with your father. And she said, when I heard that story, I started crying. And I said to her, that's what the staff do. That's the special care that they provide, the humanistic approach to end of life that they provide patients and families. And that story sticks with me. And that's what I've learned over the year, that what these staff do, you don't have to tell them these type of things. They just know innately what to do and how to help patients and families in a very difficult time and a very emotional time. And they do it right. And that's what's so special about working here, is to working with colleagues who think that way.